Welcome back, ladies and gentlemen. To the returning subscribers, thank you so much. And if you're just bumping on this video for the first time, kindly consider subscribing. Kindly like, share, comment, and let me know your thoughts about this particular video. So in this particular episode, I want us to talk about a topic or matter of discussion that I normally hear most people talk about that make quite a heck of a mistake. So it is not true that whenever you come to hospital, whoever you will see is a medical doctor by profession. However, it is technically true that whoever will attend to you qualifies to be called a doctor because they have provided medical services. But due to professional squabbles and everything, legally, it is not that everyone you see is a doctor. So today, let me take this opportunity to explain to you various practitioners or rather cadres or healthcare provision providers who we have in our hospitals. Welcome. So whenever you come into hospital, most likely, more than not, it is that the first person you'll meet is a nurse, and the nurse will help in carrying out triaging or taking of the vital signs, which we had talked about in the previous videos that we talked about. So they will receive the patient, triage the patient, and clear the patient to be seen by the consulting doctor or clinical officer. It is important to note that nurses normally pursue a course is in nursing, both diploma and also degree, so the requirements are as attached below. The next person who you are likely to meet in a hospital is a clinical officer, in which in Kenya, most likely all Kenyans have been attended by a clinical officer. So clinical officers pursue a course called clinical medicine and surgery. However, there is a subsidiary branch of this particular cadre called clinical officer or clinical medicine and community health. So clinical medicine is a profession that was introduced in 1928 during the colonial period due to acute shortage of doctors in the country. So the government of the day saw the need for healthcare provision to the citizens, and they introduced this profession called clinical medicine. So it was introduced so as to train quite a number of healthcare providers within a short span period of time, so as to ensure that the health needs of the citizens of the country are well catered for. So currently, for you to qualify to do clinical medicine and surgery, you have to have a mean grade of C plane, a C plane in biology, and at least C minus in chemistry, physics, and mathematics. It is important to note that clinical medicine can be pursued at a diploma or degree level, and after doing these basics, either diploma or degree, you can advance to the next phases, including masters in clinical medicine, where you choose the specialty that you'd like to take. It is also important to note that once you do clinical medicine and surgery, you can also specialize in other areas like ophthalmology, reproductive health, psychology or psychiatry, and oncology. It now depends, also odology or ENT. So it depends in your area of interest. So clinical officers mostly form the first line of defense in provision of healthcare systems in Kenya, healthcare services in Kenya. So most of the outpatient clinics or hospital or dispensaries that you will visit, most likely you'll be seen by a clinical officer at first line of defense. So it is important that these people get equipped very well and get acquainted with various conditions, because any disease that they will miss to diagnose, for instance cancer, can be left untreated, and the patient may now realize that they're getting worse when the disease have progressed into further worse stages. They are skilled to see patient in outpatient departments, also inpatient, diagnosis and treatment of common ailments, and performance of minor surgical procedures. However, when it comes to this, there have been squabbles, also disagreements with other professionals like the doctors or medical officers. However, it is in their scope of training to perform some sort of surgery, and that could be a topic for another discussion another day. They are also protected by the Constitution under Clinical Officers Cap 260. However, I'm not sure whether the cap changed due to various constitutional amendments or professional improvements. However, we'll check on that. The next person who you will most likely see is a medical officer. So if at all a condition has not been managed by a clinical officer and a referral has been made, most likely the next person you will see is a medical officer. So these are the people who have done bachelor's degree in medicine and surgery. Their roles, more or less the same, resemble the role of clinical officer. They also see you also at outpatient. They can see you at outpatient departments or inpatient departments. They can prescribe medication, do diagnosis, and treat accordingly. However, the differences in roles comes into some procedures which they do, which clinical officers are not authorized to do. However, these procedures could be advanced, and in most cases, majority of the population in Kenya could not have undergone such procedures. However, it is important to note that they also form backbone of healthcare provision in Kenya. So after doing a bachelor degree in medicine, they also have liberty of specializing and doing residency, and they specialize to become eventually consultant. So you can become consultant gynecologist, consultant ophthalmologist, and consultant oncologist, or any other field that you wish to venture into. So when you listen to these two professions, they almost look alike, intertwined. However, they work hand in hand together to complement each other. It is important that bachelor's of medicine degree takes about 6 years, followed by an year of internship, and that for clinical medicine also diploma takes 3 years, followed by a 1-year internship. It is also important to note that within the hospital or healthcare setup, there are other professions like nutritionists and physiotherapists or occupational therapists, and there are other many professions that you could find there that help to ensure that health is provided to all citizens equally and in each time that someone is in need. So those are a few of the professionals that most likely majority of you guys will meet whenever you come to a hospital. However, it is important that despite the difference in the titles and the roles that they do, it is important to know that they have to work hand in hand to ensure amicable provision of healthcare services in our hospitals and to ensure that everything runs in a smooth manner without any discrepancy or hitting the toe on the stone. So having said that, I know that now we are at back, and next time when you get seen in a hospital, you will most likely be seen by either clinical officer, a medical officer, or that person who will do trial for you is most likely a nurse. And the person who will give you the medications is also a nurse. It is also important to note that at the point where you are given medication, you have other professions like farm tech or pharmacists, so that one will be a topic for another day. However, it is important to note that that person who is giving you medicine, they have also done a specific course for issuance of those medications. They have read most likely how those medications work on the human body. So it is important that you take note of that, and up to that point, thank you for watching this day's episode. And let me introduce you again to my new telemedicine adventure. It is an adventure that I'm taking, knowing that nowadays health has become so expensive in the form of transportation to and from hospital, purchasing of medications. What about if you have to forego the transportation bit and just access healthcare services at the click of your phone? Yes, that is possible by contacting the number which I've given down below for any consultations which you may have. I offer telemedicine, or rather online consultation, through that number which I've given down there below, but of course at a fee which will be communicated. So whichever condition you have, anyhow you are feeling, kindly contact me and we'll be able to assist and give you prescriptions that will ultimately work for you. So until next time, this is Kowegido. Kindly consider subscribing, share, like, and comment. Thank you.